for the Global Coalition on Synthetic Drugs. Beginning this month of November through February, we will be looking at specific initiatives available to us through our international organization partners. We will also be exploring new activities or policies that we can initiate. In January and February, we'll have the full menu of activities available for review, and we will invite you to express your interest to the international organizations who will be managing the respective initiatives. I will turn it over to our co-chairs for today's meetings to call on presenters, share thoughts, and moderate the discussion. We have from Costa Rica, Giovanna Calderon, and from Trinidad and Tobago, Justice Jeffrey Henderson. Over to you all. Thank you so much.
Thank you very much, Brian. Well, we have a very interesting hour. We are starting just a tad bit late, so I shall keep the introductions very short so that we can get back on time and leave as much time for questions. So the first speaker will be Anja Busse. She is the Program Officer, Prevention, Treatment, and Rehabilitation Section of the United Nations Office on Drugs and Crime. Anja, over to you.
Thank you so much. I think we have a pre-recorded video. We can show that. That was the video we had mistakenly played. Yeah, there it comes. Great. Thank you. Thank you so much for the opportunity to present to you our initiative on treatment and care of drug use disorders for people in contact with the criminal justice system, with a focus on alternatives to conviction or punishment. As you know, the best response to treatment of drug use disorders is evidence-based treatment, such as what we have laid out in the UNODC WHO International Standards for Treatment of Drug Use Disorders. It has proven not only to reduce drug use and improve the quality of life and health of people with drug use disorders, but also to reduce associated crime, while it costs less than doing nothing, than incarceration, than probation, and it also kind of produces additional positive outcomes for the entire community. Nevertheless, many people with drug use disorders are in contact with the criminal justice system, including only for offenses related to personal use of drugs. So here you can see, based on UNODC estimates, that even at the conviction level of the criminal justice continuum, more than half of people are in contact with criminal justice system for drug possession for personal use offenses. We do know that drug use does not stop in prison. On the contrary, estimates say that there is 4 times as much drug use in prison than in the general community, and there is very limited access to treatment of drug use disorders in the criminal justice system. So it's really a prerogative to keep people who are in contact with the criminal justice system for personal use offenses in the community and offer the best treatment we have. And in that context, also keep in mind the global prison overcrowding crisis, to which we could contribute by, again, keeping people that do not require incarceration, people with drug use disorders, personal use of drugs in the community, and support them there instead of sending them to the prison system. But nevertheless, we see that there are way too many people not only in prisons, but also in so-called compulsory treatment or detention centers, or in clandestine centers that do not have a license, that are often associated with human rights abuses, or people find themselves without any access to treatment of drug use disorders, as a global gap for treatment of drug use disorder prevails, and at best 1 in 5 people with drug use disorders has access to treatment. Just to say that compulsory treatment as such is ineffective due to the biopsychosocial nature of drug use disorders, and that human rights abuses and degrading practices have no place in treatment of drug use disorders. The use of compulsory drug detention and rehabilitation centers is a custodial measure, and such does not qualify as a non-custodial alternative to conviction or punishment. UNODC and partners have called frequently for the closure of compulsory drug treatment or detention centers. So the good news is that there are multiple international policy agreements that support treatment as an alternative to conviction or punishments, especially in cases of personal use and other minor offenses committed by people with drug use disorder. So for example, in the International Drug Control Conventions, the parties to the conventions, the countries, have taken a commitment to provide a continuum of care, including prevention, treatment, rehabilitation, aftercare for people in need, and they have agreed that these measures can be offered, including as a complete alternative to conviction or punishment in cases related to personal use and other offenses of a minor nature. Please also take into account the larger kind of international legal framework where the United Nations standard minimum rules for non-custodial measures, or the Tokyo rules, really call on us to consider prison really always as a measure of last resort, and the Bangkok rules that have specified this further for women in contact with the criminal justice system. Also, we need to take into account international human rights obligations. I've just, as an example here, mentioned the right to health, but there are also additional rights like the right to be free from degrading treatment or medical experimentation or other things. Both the Commission on Narcotic Drugs and the Commission on Crime Prevention and Criminal Justice, UNODC steering bodies, have taken this up several times and put it into more detailed resolutions, like CND Resolution 58.5 on supporting the collaboration of public health and justice authorities in pursuing alternative measures to conviction or punishment for appropriate drug-related offenses of a minor nature, and have called or invited UNODC in consultation with member states to provide guidelines and technical tools to enhance this justice health collaboration, and have also invited member states in collaboration with UNODC and relevant other entities to work on technical assistance and training to improve health and justice collaboration and the implementation of alternative measures to conviction or punishment for appropriate drug-related offenses of a minor nature. In 2017, already UNODC and WHO have launched a respective initiative, Health for Justice, Justice for Health. And we have developed a range of technical guidance documents, including on how to best do treatment of drug use disorders and how to do it as an alternative to conviction or punishment, at what stage and how to refer people out from the justice system to the criminal justice system. We have mapped the current situation with regard to alternatives to conviction or punishment. We have implemented training materials, and all of this is available for you, and we are continuing to provide further guidance. As you can see here, as I'm highlighting our future plans, we want to do a continued mapping of diversion opportunities that exist in the world through different ways. We will include the work on treatment as an alternative in the dissemination package of the international standards for treatment of drug use disorders. We are continuing, and we need your support and interest to continue providing technical assistance at country level and demonstrate that treatment as an alternative is also feasible, and we can demonstrate the outcomes in low middle income country settings. We are also working on the development of implementation principles for treatment as an alternative based on extensive expert consultations, and to make implementation at country level more easy and more manualized. And please also note that we are finalizing an online training course on treatment as an alternative. And we are considering to develop kind of a quality assurance package for treatment as an alternative for countries that have already started this work. And obviously, we're linking with different partners and networks in the different regions, some of which you might hear today about as well. Please also note that in this overall initiative on Health for Justice and Justice for Health, we are also considering more and more the needs of people that might have to go to prison and have a drug use disorder, and how we can best offer and support evidence-based treatment of drug use disorders in prison settings and upon release from prison. Please.
Thank you. Over to you again.
Thank you very much, Anja. So we're now going to turn to listen to the next presenter, who is Michele Worobiec. Michele?
Thank you. It's a pleasure to be here. Let me quickly pull up my slides. And here we go. Perfect. All right. During our limited period of time, we had a couple of goals to share with you. One is to explore how ATI country development and support can take place across the entire justice continuum, and also introduce you to the International Consortium for Alternatives to Incarceration. So let me get right into the content. If my computer cooperates, there we go. Building upon what Anja just explained about the effectiveness of treatment and care, I want you to keep in mind what the structure of that looks like. So it's a multi-system collaboration between the justice system, the treatment system, and social services. Here, with the justice system, we want to make sure that we quickly identify through validated screening tools that individuals coming into our system are actually in need of treatment and care. Once we identify individuals that might need that care, we need to quickly engage with the treatment system for a more thorough evaluation and to assess the levels of care that are required. And so justice and treatment will work together to make sure that justice provides any needed supervision or accountability. Treatment provides the clinical care and services. And of course, we realize that it's critical to make sure that we build the protective factors of those individuals and resolve any of the social determinants of health where they may have instabilities, and also bolster their thinking skills, their life skills, and other things that may place them at a higher risk to going back into the justice system. All of this is tightly wrapped around through a comprehensive multi-sectoral case care management system. So generally, this is a cooperation between the systems, and we can see it happen in all parts of the justice continuum. So I know this is small, and you'll have a copy of these slides later, but we're going to have a basic overview here. So at the pre-arrest stage, we have an opportunity for law enforcement and other first responders who are called to the community emergency to determine whether or not this is really a legal emergency requiring court involvement, or if it's more of a health crisis that requires engagement in treatment and care. And in the United States—
My apologies, Michele, my apologies. Interpreters are asking you to slow down, please. Thank you.
Okay, no problem. So at the pre-arrest stage, we have an opportunity for law enforcement and other first responders to identify the crisis as a health condition, a need for SUD treatment and co-occurring disorder treatment, and maybe also to bolster some instabilities with housing or food insecurities and the like. Referring directly to the services at this level will avoid any of the negative consequences of arrest and further involvement in our justice system. Going further into the system, if there is an arrest made or a referral to a court proceeding, then we have an opportunity both at the inquisitorial phase, either by prosecutors or magistrates, or further in the adjudication to consider whether we need to have the full justice system involved, or again, whether there is an opportunity for a structured intervention with treatment and care. At the prosecutorial level, generally those are cases where we don't see a significant risk for recidivism. And when it gets deeper into the court system with the judges and magistrates, that might be more appropriate for a case where we realize that there could be a likelihood of someone returning to the justice system and requiring extra care, or that the nature of the behavior that brought them into the justice system requires tighter oversight and structure. And then finally, even if someone is convicted of a crime, we have an opportunity after that conviction to decline to put someone in jail or prison, to suspend those sentences and to allow treatment and care as a part of community supervision. Or if someone is serving time in a jail or prison, commonly people will ask, what about murder? Well, if there's murder, there's likely going to be some time in the correction system. But upon release, we need to realize that those individuals require the treatment of their substance use disorder and all of the stabilities. So we need pre-release treatment and services and planning. We need the transition planning, and then we need the services to continue as they re-enter and try to reintegrate into the community. ICADI is a new organization. We will be hopefully launching at the CND this coming year in March. And we were formed to extend the conversations that we're having today, to provide resources, to create networks, and to support ATI development for countries, for communities, for individuals. We're really able to be kind of the first stop for ATI. And so you can see here 3 areas that we'll be working on. One is supporting the exploration and development of ATI for countries and communities. Also making sure that we can link you to all the wonderful resources. You've already heard from sources that are available from UNODC and other colleagues, and we will be adding to that the field of information and evidence that is available to guide your efforts. We can extend the learning, so having robust webinar series, informational materials that accompany those, developing specialized ATI curricula to build upon our current policy leader course and our case care management course, and also working to develop a global atlas of ATI initiatives along with quality indicators. And finally, a network. So you're not going to be doing this alone. We will have an opportunity to bring countries and professionals and systems together to give you the ongoing connection with colleagues and support. Finally, I wanted to review what we have seen as a progression of ATI development in countries. It starts off initially with perhaps where many of you are right now. You have interest and you're interested in exploring the issue. From that, when there is an interest to develop ATI, there's a period of systems preparation to make sure that your justice system, your treatment system, and your NGOs in the community are ready to launch this kind of a system and are starting to work together. Then in phase 3, it typically involves the ATI policy leader course, technical assistance, support for implementation, and data collection. At that point, often countries are partnering with our international organizations like UNODC, or OAS-CICAD, and Colombo plan. And then through phase 4, we look at ATI expansion. So it's not just one program at one part of the justice system in one part of the country that will really provide the robust interventions we need. So ATI expansion can look at that geographic expansion as well as expansion across the intercepts. I'm sure my time is coming to a close. So the last thing I would like for you to do is to please engage with us so that we can continue the conversation. You are the first group to see the new ICADI email, so you can reach me at michele.worobiec@icadi.org. I was not able to get a MailChimp link to put into the chat box, but we will quickly have ways for you to sign up for information. And I welcome the opportunity to continue the conversation. Thank you.
Thank you, Michele. You were very helpful, incisive, and you also almost brought us back on time. So if I could introduce now my dear good friend, Antonio Lomba. Antonio. Now, Antonio's chief, I should just tell you, Antonio is the Chief Institutional Strengthening Unit of the Inter-American Drug Abuse Control Commission of the Organization of American States, SECAD. Antonio.
Thank you so much, Your Honor. What a pleasure seeing you, and happy to see you all. I don't know if I have the way to share the screen. Oh yeah, here we go. Thank you. There you go. Can you see the screen?
Yes.
Wonderful. Okay. Well, good. For those who don't know who we are.
Antonio, my apologies. You need to be on the English channel. Can you please select the English channel? You need to click the icon of the globe, please. And if you speak English, select the English channel and continue. Thank you so much.
Oh my goodness, I'm going to waste everyone's time with this. Sorry, my mistake. Hold on a second. Now that I'm sharing the room, I don't know how to go back to the other thing. It's amazing. We've been working with Zoom for years now. And now.
Don't worry now, Antonio, we'll get it. We'll get there.
And Antonio, you may want to stop sharing if you don't mind, because your interface probably disappeared. And
yeah, that's
then,
what I'm trying to find.
Yes,
stop it.
please, there is a stop share button, the red button that you need to click, please. And then you will be able to stop sharing.
well, I don't know how this is. Hold on, my apologies.
Let me go ahead and try to stop sharing for you. Give me 1 second.
Thank you, because it's just the bottom doesn't show up now at all. Oh, here we go. Yes. Okay, good. Thank you.
Okay, very good. So if you can please click the icon of the globe on your screen and select the English channel and continue.
I am there. Okay.
Thank you, sir. You can go ahead and go ahead and restart sharing and start your presentation. Everybody, sorry about the technical glitches.
My apologies. All my mistake. Thank you. I appreciate it. And you see the screen? Yes.
Yes.
Yes, we can. Go ahead, please.
Wonderful. Good. Okay. Well, for those who don't know what SICAD is, the Inter-American Drug Abuse Control Commission, we are part of the Organization of American States. Many of you have worked with us already in the past. It's a forum for the discussion of drug-related matters in the hemisphere. And we, at the Executive Secretary of SICAD, we provide technical assistance and support to member states, to countries, to support, any kind of implementation of programs, technical assistance in many, many ways. I'm not going to go into the details, but the unit where I work, which is the Institutional Strengthening Unit, is the one that focuses on three major things: supporting the development of national drug policies, under which sometimes we include, and many times we include, countries include alternatives to incarceration. Also, one of the pillars of the work we do is alternatives to incarceration. Many, I'm going to go into that in detail, and also alternative development. But going directly to the topic on alternatives to incarceration, and this is something I'm very glad that Michele presented earlier than me, and also Anja, because some of the things that I will not need to repeat, they were said. I wanted to, Michele described at the very last part of her presentation, the very major steps towards the implementation of alternatives to incarceration. Let me just use most of my time to talk about the step one, partnership development, because I think is a crucial element in the development of any alternative to incarceration. Believe it or not, countries, sometimes individual courts or individual in different stages of the judicial system, have been implementing alternatives to incarceration of many kinds for years. Current legislation in countries allows in many countries to divert or send people to a health facility or treatment, or individuals with a health-related problem that committed a crime or in conflict with the law, to have mental health in many cases, but also for those who suffer from substance abuse problem that are in conflict with the law. Most of them are minor and non-violent crimes, but are related to addiction or to drug possession, etc., etc. We've encountered along through the years, which is the very interesting thing, that when we go and support any kind of implementation of alternatives to incarceration, that the country itself has alternatives to incarceration in place. They may not know it, and sometimes it happens at the very local level. Judges, or how is that possible? Just really judges sometimes in a court, or many actors and the law enforcement, whenever they divert or create some kind of a partnership with the community from the judicial system, or, at the end of the day, individuals that are related, that are dealing with these individuals every day, they are tired of the constant revolving door. People who come, go to prison, get out of the prison, come back again before the court. At the end of the day, and those who are dealing with that every day and are here together with me, I'm sure you will agree, is the same person, the same face, the same problem, and only that the problem really keeps growing, and it gets bigger and bigger and more complicated to resolve it. These judges and many actors involved, social workers, court liaisons, probation officers, champions, if I can call it that way, champions in this particular matter, finds ways to resolve conflicts at the core or the community levels. I'm sure you have heard about the problem-solving courts. As the Chief Justice of Trinidad and Tobago one time said, solution-finding courts, better than problem-solving courts. But in any case, in all those cases, they've seen and realized that it's not enough. Sometimes just doing that at the local level is not enough to make it expanded to the whole country. And sometimes a Chief Justice or an Attorney General or a legislator, or even from the civil society, or a mayor, even from a city, decides to take a bigger step and ask for help. So the efforts do not remain local and have the chance to expand and consolidate. And this is when we, international organizations, regional, international institutions, experts at the end of the day, all come on board. Some countries are already implementing alternative to incarceration models, while others are in the developing stage. And that means that They may need a little support because they're already doing that, or they may need to go from scratch and start with the basics. From our experience in the last 15 years from the OAS supporting countries develop and implement and evaluate alternative incarceration, here's some basic factors that we think that we look for when we were going to this developing stage. Leadership. If you don't have a leadership or authority that will lead this process, it will be very difficult to implement that at a national level, even if you go through piloting models. Understanding, and thank you, Anja, for that presentation, understanding what substance abuse is, treatment, what that involves, and also the importance of social integration. If you don't have a social integration program, at the end of the day, people finding jobs, going back to education, family, etc., the system doesn't work. The alternative to incarceration will not work. Openness to accountability, creating baselines for future evaluation. That's another key element. Team approach. This is something you cannot do alone. You need the whole team, and you need to create partnership and do interagency cooperation. Because steps 2 and 3 all depend on that first step. And training and action planning are crucial. It requires really precise identification of needs, the high risk, high need, evaluation of those things, a capacity to collect information and to be able to make adjustments along the way with that information, capacity as well to analyze that information, and also in short-term and long-term, see if it's a need for regulation or for new legal landscape to support that. Some countries just start with a policy document and they become, they realize that they need a legal landscape afterwards. But this is, we've been working with 18 countries. I'm not going to go into each of them. Many of them are here today with us, but there are 18 countries right now that are either exploring or implementing or evaluating alternative to incarceration of many kinds. Just realize that in 2010, there were only 5. So this is something that 20 years ago, we couldn't even talk about this. Now there's a huge amount of countries in the Americas that are doing alternative to incarceration. You can find restorative justice models, therapeutic justice, community courts, community justice, re-entry models, document courts, wellness courts, you name it, but both approaching reaching adults or juveniles. These are just some of the examples of projects that we are supporting right now from the OAS. I've mentioned some of those models already, but establishing monitoring evaluation models, implementing alternative to incarceration of any of those kinds, in 14 member states right now, developing evaluation tools, even to find out the eligibility criteria for alternative to incarceration programs, gender in the criminal justice system. A lot of countries are getting more involved into considering gender aspects on the alternative to incarceration and working on very concrete piloting projects. Case care management project, that's a model that is an essential model, and also strengthening therapeutic communities, supporting, having the rest of the actors at the local level involved in finding, at the end of the day, a job for the individual that goes to the justice system and is to go back to society, etc. That's all from my end. This is my name, email. There is a lot of members in my team, in our team, that are supporting member states, that are the reason why we can do this. And that's all from my end, Your Honor. Thank you.
Thank you, Antonio, for that very helpful presentation. So next we will hear from Charlotte Colman. She is an associate professor, drug policy and criminology from the University of Ghent, and national drug coordinator / president of the General Drugs Cell. So I think she's gonna give us a presentation, a video presentation.
Good day, everyone. I'm Charlotte Colman. I'm a professor of drug policy and criminology at Ghent University in Belgium, Europe. I have been collecting stories about people in recovery from addiction and desistance from offending for several years now. And from that research, we know that most people who get addicted and are offending, that they do recover and desist, although it might take some time. And people overcome addictions and offending by a combination of 3 factors. Personal factors like I'm getting older, so I want to change. Social factors like I met a woman of my dreams, so I want to change. Or then community factors. These are the resources offered by a community to be able to change. And it also became clear that for most people that I've talked to who have been involved in drug use, but also offending related to that drug use, that recovery comes first and that recovery leads to desistance, which means that for many people involved in the criminal justice system because of offenses related to drug use or addiction, that working on recovery might also lead to less recidivism. In my short talk today, I will not focus on the individual and social factors of recovery, but I will mainly focus on the community factors, because for me, what is equally important as willing to change is to be able to change and to be able to sustain your change. I had the chance to meet lots of wonderful people during my academic career, and one of them is Caroline Cooper. And Caroline, she studied how Native American tribes, how they deal with addiction and recovery. And for these tribes, the health of the community is only as strong as the health of its individual members, which means that when you get on the wrong track, that the community intervenes as a whole. And this is very different from what I have learned in working with my cities, my Belgian cities, because in Belgian cities we mostly tend to focus on what is wrong and could go wrong again in the future. So we mainly focus not on empowerment and agency and strength, but we mainly focus on relapse and recidivism. We all know that people who struggle with addiction, even those in recovery, they experience stigma and discrimination. And surveys, they have indicated that the majority of citizens, so people like you and I, that we agree that we should support recovery. But when we ask about how they feel about more personal interactions with people who use drugs or people in recovery, many had concerns. More than 40% do not want to live next door to someone who has been dependent on drug use. And most employers, they don't want to offer a job to a person in recovery, even if that person is fit for the job. And these kind of surveys, they present a NIMBY principle, the not in my backyard principle. They tell us that addiction could often be seen as an irreversible stain, that people with active addiction, but also those in recovery, that they might face the same discrimination, that employers and landlords, that they don't trust them, but that even their family, their loved ones, that they don't trust them anymore, which means for some people in recovery, no work, no house, no safety net. So the question is, how did we get there? And overall, it seems that we lack knowledge of recovery. From research, we know that people discriminate more often when they are not familiar with the topic. It means that you are more reluctant to and often afraid of something that you don't know about. And another reason could be our resources, a lack of resources or a different allocation of resources, because mostly, in most cities, only the negative consequences of drug use and addiction are visible in our cities, like needles in the park, intoxicated people dwelling on the streets, and we mainly invest in making those negative consequences invisible, instead of making the good news, recovery, for example, to make that visible. And the question is, how could we change this? So quite easy, maybe by making the good news visible and to make recovery visible, to talk about it and to engage people. And David Best and I, he's also an expert in recovery and desistance, we have visited communities, we have listened to practitioners, to people in recovery, to people struggling with addictions, etc. And from that experience, we came up with the idea of an inclusive recovery city. And we made a step-by-step guidebook to help cities transform into inclusive recovery cities, especially focusing on those community factors leading to recovery. And today we have several cities across the globe who are transforming themselves into inclusive recovery cities. So to explain it very shortly, we use the city as our playground, and we bring all relevant stakeholders that had a thing to play in recovery, we bring them together in order to organize events and to promote knowledge regarding recovery and to spark engagement. So these are not ad hoc events, but organized events. And the main goal is to first make recovery visible, and second, create activities to spark knowledge, to create visibility regarding recovery. And the first step is that you install an Inclusive Cities Council. And this is a core group. It consists of, for example, prevention workers, treatment workers, policymakers, city council members, academics, employers, citizens, and especially people in recovery. And this core group, they focus on two things in the beginning. So first of all, they make a mission statement. They make a definition of how they see and understand their inclusive recovery city. And based on that mission, they are going to develop activities with all relevant stakeholders. And we advise to organize activities every 6 months to keep people engaged and to spark that knowledge, to make it discussable and to celebrate recovery. Indeed, you heard it correctly. We are about celebrating recovery because we celebrate a lot of events in our lives, like births, graduations, marriages, and this involves ritual. And ritual, it fosters social bonding. It strengthens solidarity, it strengthens social cohesion, and brings people together. And celebrating recovery is beneficial for a person in recovery, but also for the whole society, because people in recovery are often called recovery champions. They are the living proof that recovery is feasible and possible to people still struggling with addiction, for example. So the point is to activate all these people who want to make a change and to translate the intention in structured actions and to bring everyone and everything together. And these actions could consist of very small things, low-key ones or more structural ones, and this basically depends on the resources that are available in your community. And one of the examples is, for example, Jobs, Friends and Houses in Blackpool. This is a social enterprise model, and in this project, people in recovery, they learn to build and renovate houses during an internship. And afterwards, these houses, they become available for sale or rent by people in recovery. Another example is a recovery game in Doncaster, but there are similar examples in other cities. And it started as a button-up project, and it is organized every year. These are fun-based sports activities with practitioners, people in recovery, the families, but also the community as a whole. And the latest edition, they had 1,000 attendees from England, Scotland, and Wales. But it could also be about the smaller things, like the words that we are using. Our words are very powerful, and it only requires a small effort to choose our words wisely, to choose that we show ability to help and to encourage rather than to hinder and hurt someone by our words that we are using. Because evidence demonstrates that if you are exposed to words like drug user, addict, offender, it increases stigma and discrimination, which could lead to people with addictions failing to find support and poor treatment outcomes. So, in a nutshell, if you want to find more information about inclusive recovery cities, we have a website. It's still in construction mode, but please feel free to visit it. And if you have any other question, you could email me and I will be happy to answer it. Thank you.